A strong show of opposition makes its way to the state capitol. Advocates, families, and lawmakers are pushing back against a plan in Michigan to shift how community mental health services are run. Mid-Michigan Now's Andrea Flores traveled to Lansing, where the Walk a Mile in My Shoes rally took place.
Right behind me on the steps of the Capitol, Michiganders came together to say no to privatizing mental health care. They say the Michigan Health Department of Health and Human Services plan to privatize mental health care will hurt the people who need help the most.
The state is proposing to shift community mental health services now run by local public agencies to private health insurance companies. Opponents say that would add red tape and cut off care for the people who need it most.
Right in the middle of some of the Medicaid cuts that we're going to receive from the federal level, now's not the time to deconstruct the safety net system that we have to take care of people.
The Walk a Mile in My Shoes rally is about raising awareness about mental health, and this year it's also about fighting privatization.
It's a significant concern. I've worked in the public mental health system for 38 years, and we need to have a safety net. And the public system is the way to do that.
Connie Conklin is the executive director of the Livingston Community Mental Health Authority. She says this rally is all about breaking stigma and having open discussions about mental health.
In the last few years, people have been more likely to come in for services than they ever have before.
Advocate Emily White with the National Alliance on Mental Illnesses in Lansing shared her personal story, saying community mental health helped her turn her life around.
They were able to provide services that I needed, not that I could only afford, because we know that that's a big difference sometimes, right? And so that made the difference between having therapy on a monthly basis as opposed to a weekly basis.
White adds that right now, the biggest thing stopping people from getting help is stigma. Jeff Patton, CEO of Integrated Services of Kalamazoo, says the state's timeline for this plan is unrealistic and dangerous.
To disrupt those systems can potentially disrupt the care for people that are being served.
Advocates say they'll continue to push lawmakers to step in and pause the state's plan. Reporting in Lansing, Andrea Flores, Mid-Michigan Now.
In a statement, the Michigan Department of Health and Human Services indicates it's committed to ensuring Medicaid beneficiaries in Michigan have timely access to high-quality behavioral health care services, saying in part, quote, "This procurement reflects significant structural changes designed to improve service quality, increase accountability, and enhance administrative efficiency across the system." The competitive bidding process is designed to address these concerns by creating a more unified, transparent, and balanced behavioral health system, end quote.